Burkina Faso has moved to reduce the cost of essential medicines through state-led pricing reforms, while countries like in the neighboring country, Nigeria, continues to focus on regulation and enforcement against substandard drugs, exposing two different visions of how governments should protect public health. Now, here is the announcement from Burkina Faso's government. Uh, I'm going to play that video for you in a minute.
Presentations, authorized missions abroad, and made major decisions for the smooth running of the nation. On behalf of the Ministry of Economy and Finance, the Council adopted a report on the adoption of a decree on the conditions and procedures for building headquarters for large companies in Burkina Faso. For more information, I call Comrade Abubakar Nakanabo, Minister of Economy and Finance. In December 2025, the National Assembly adopted the law requiring the construction of headquarters for large companies in Burkina Faso. An implementing decree is planned for the implementation of this law, which will define the procedures for implementing the law. And today, the Council authorized the adoption of this decree, which will make it possible to operationalize the law on the ground. It should be noted that the plan is for a turnover of 5 billion. The 5 billion corresponds to the average turnover of the last 3 financial years. So all large companies with an average turnover of at least 5 billion over the last 3 financial years are eligible for the obligation to build headquarters. It also provided that for these companies, there is a period of 6 months from the adoption of the law to submit a construction application to an interministerial commission that will examine and ensure that all the conditions are met. And of course, from the validation of the application, the company has a maximum period of 36 months to build its headquarters. Categories have been provided for companies with a turnover according to the set criteria greater than or equal to 100 billion CFA francs. The category is Category A, and the building standard is at least R+7 with underground parking and surface parking. There are also energy efficiency criteria. And for companies with a turnover of between 50 billion and 100 billion, it is a class B, and the standard is at least R+5 with underground parking and surface parking For companies with a turnover of between 50 billion and 10 billion, it is Class C, and the standard is at least R+4 with surface parking. And for companies with a turnover of less than 10 billion, it is Class D, and the status is at least R+3. The decree, after its signature, will enshrine the effective implementation of the law, and we invite all large companies to comply as soon as possible, because the law also provides for exemptions on construction materials and to facilitate the construction operations of these companies. And in terms of land, there is also land that has been made available for these companies to purchase and build their headquarters. So we invite all companies to comply as soon as possible so that the implementation of this law is effective from this year. On behalf of the Ministry of Health, the Council heard an oral presentation on the reduction of the selling prices of essential generic medicines. For more information, I call on Comrade Robert Cargu.
On behalf of the Ministry of Health, we made an oral statement to the Council regarding the reduction in the sale prices of essential and generic medicines and essential health products and certain medical consumables. And at the end of this reduction, for example, for injectable forms, we can have reductions of up to 53% souveraineté. For certain compressed forms, we can have reductions of up to 67%. For medical consumables, we have reductions of up to 72% for certain syrup forms. The reduction can be up to 20%. So the financial impact of this reduction is around 3 billion CFA francs, many. So 3 billion CFA francs are borne by the state instead of Burkinabe households, and therefore Burkinabe will be able to save around 3 billion CFA francs and to reinvest in other item por items. And I would like to mention that this reduction in the cost of medicines will come into effect from March 1, 2026. Obviously, this is a measure that is fully in line with the pragmatic vision of the head of state, who wants all Burkinabe people, and in particular the average Burkinabe, to have equitable access to health and nutrition care and services. Las Terres and medicines are an essential part of this package.
Now there, this is ultimately when I bring Nigeria to compare with Burkina Faso taking this measure. It's not really ultimately about simply, which country has chosen the right approach, but about also how African governments navigate the difficult balance between affordability, safety, and self-reliance in healthcare system. So as global supply disruptions and economic pressures continue to affect medicine markets, the choices now being made in West Africa, from price controls to regulatory reform, may shape broader debates about the future of African pharmaceutical independence and social policy. In concluding this about what kind of change the government or price reduction has made, here is, the numbers that we have got. The Burkina Faso government has implemented significant nationwide reductions in the cost of essential generic medicines to improve healthcare access, with price cuts including up to 70%. So key items like anti-venom serum up to 90%, and other reforms. These are supported by the Central Purchasing Office for Essential Generic Medicines, which came actually during the structural changes. It became a state-owned company in March 2024. So there are critical items, for example, the anti-venom dropped by 90% from 21,800 SEFA to 2,000. Also, like marginal reductions on commercial margins for district level distribution depots. Also, they were lowered up to 7.7%. And the impact, of course, the availability rate of critical products increased from 45 to 75%. That is a big change. Yeah. So thank you again for tuning in, and let us know in the comment section, what do you think of this measure by Burkina Faso, led by its leader, Captain Ibrahim Traore, and compared to the measures taken countries like in Nigeria. In medicine, people still suffer because of the substandard medicines that are distributed in the countries, the corruption, and why the governments in Africa, especially when it comes to human life, cannot perform better, why they cannot take such measures that's taken by Captain Ibrahim Traore, and also, that of Niger and Mali. I mean, what do you think is the difference really? Let us know in the comment section. Thank you again, and I'll see you in the next one.